Dr. Kemi Olunloyo for Kemi Talks Media. We're still on Saturday, the 22nd of March, 2025. I have started to give you so much information in health news, but I have to break the bad news to you. I started after I retired from journalism, 31 years on February 9th. Then I took a 1 week break and I came back on the 17th of February till today, which is now what we will call 6 weeks of health tips, health information. I became a certified health educator in 1988, and it was my final year in pharmacy, and I graduated in 1989. So May 4th, 1988 and May 4th, 1989 were my graduation dates respectively. So if you look at it, that's 36 years in pharmacy. Here's the sad news. On May 4th, 2025, just like I did with journalism, I'm not counting down this time, okay, in about roughly 30 days from now, end of April, early May, I'm going to retire from pharmacy and healthcare. I'm going to totally retire from the healthcare industry. I feel that I've put a lot out there and I've done my best for society at large. I went to Nigeria for 11 years. In 2014, I was on the streets educating fast food people and street food people about Ebola and the safety. During the pandemic in 2020, I educated a lot of people using social media, IJ COVID-19. I have contributed a lot to health in Nigeria, and I've been giving you at least 6 weeks of health tips and what you need to know. Some of the things that many of you don't know in Nigeria, and you're finding out from me. So I've put all that great stuff out for you. And today there's a lot of people educating about health. Some of them are not health professionals. I mean, Instagram, TikTok, everybody's some kind of dietitian, nutrition, people, nutritionists, doctors. Doctors have joined. Doctors don't talk. They are like dancing and putting their hands up to the content. I don't know that style, but I talk to you. Okay, I don't want to see a doctor dancing and tell you 3 things you can't do and they'll put their hands up. The Nigerian doctors are doing it now as well. Okay, I prefer to talk to my patients. So I've done clinical pharmacy, I've done retail pharmacy, I've done institutional pharmacy, which is the prisons, the consulting, and the big nursing homes. And I'm an award-winning pharmacist, especially in retail pharmacy. The kind of work I did in Baltimore, okay, in Philadelphia. And also, I was one of the first 6 in the world. Well, maybe we should say in America, because it's an American program. CVS, the largest drugstore in America, had a program called the ProCare Pharmacist. We were experts in fertility drugs as well as HIV drugs. And I was one of the first 6 and the only Black to be trained by the company. CVS gave me awards for my work in HIV in the Govans community in Baltimore. And then I was honored by the mayor, the governor, and then President Clinton at the White House for my work in volunteering for drug abuse prevention. And that's how I got my green card. They gave me my green card based on that. Alien of exceptional ability. I want to thank my Congressman Ben Cardin is old now. He's in his 80s and he has retired from Congress. He didn't go back in January. Thank you, Senator Cardin. He started as a congressman. And Congressman Ruppersberger also retired. They didn't go back in January. They were Democrats. They were my congressman in Maryland. Barbara Mikulski has since retired. Several people that really, appreciated me. Congressman Kwesi Mfume is still in office. Shout out to him. He actually left and came back when Congressman Elijah Cummings died. And I want to shout at everybody, that wrote all these great things about me in 1997. Now, I also want to shout out the NDLEA, the National Drug Law Enforcement Agency, Nigeria's DEA, Nigeria's Drug Enforcement Agency. I volunteered for 30 months on their platform as a speaker, as a contributor, on the NDLEA spaces every Friday 3 to 5 p.m. I did that straight 30 months, and I want to thank them. I was there on Friday and 2 Fridays ago, and I've told the NDLEA anytime they need me for any kind of presentation that has to do with my field, call me. I'll plan it and I'll be on there. Because drug abuse does not belong in our society. It does not belong in our schools, in our workplaces, in our communities. So, aside from being a pharmacist, filling prescription, giving medicines, educating people, all the beautiful stories and letters people wrote to my companies, I'm going to post them all. I worked for Rite Aid in the beginning. Then I worked for Walmart. Maybe I shouldn't list who I worked for because I really technically worked for everybody. And it was not like I was going from job to job. I want to shout out Pharmastat. Okay, that's how I got to see everything. Pharmastat is a pharmacist agency, and the owner of Pharmastat, Greg, thank you so much. It's been a long time. We're talking about almost 27 years, but Pharmastat will send me to every drugstore, and I'll work there as what they call a relief pharmacist, agency pharmacist. I'll just show up at a drugstore and I'll be working there. So I've been in Rite Aid, I've been in CVS. I stayed with CVS for 15 years. I've worked in Walgreens, I've worked in Giant Food, Kroger Food, I've worked everywhere. So majority of pharmacies that Pharmastat sent me, and I've also had my major employment was with CVS for a long time. And of course, Eckerd. Eckerd Drugstore was the one that became CVS. You see that business card I always post. Health Educator Pharmacist. And at the end of the day, I want to thank everybody that contributed, to all the great things I did. I used to go to schools on career day. I was a Healthwise coordinator for CVS in Maryland. And I was also the health educating coordinator for Eckerd in Atlanta, Georgia. So I've reached the top, guys. It's just that when you come to Nigeria, they take you down to the bottom and people think you're nobody. I've done a lot. I have been the director of pharmacy of the outpatient community pharmacy for Johns Hopkins Hospital, the most prestigious hospital in the world. I hope you know that. And when Dr. Benjamin Carson was separating Siamese twins, I was part of that pharmacy team. Yes, I worked there. Yeah, the Siamese twins. So Benjamin Carson, you know Dr. Carson, right? I was part of the pharmacy team there. And then later I went to outpatient, and then I went to outpatient community where I served people. I created the MAP program, Ending Addiction and Pregnancy, at Johns Hopkins Bayview Hospital. And I also worked at Greater Baltimore Medical Center. All these places I mentioned, they have letters about me. And I might have posted it somewhere down the line, but I'll post them all again to thank me for the great work. Drug abuse, community pharmacy, name it, I've done it all. So I decided to come back to educate Nigerians, once again free. I didn't make a penny. All the views that I had on that TikTok could have fetched me a lot of money if I was actually in a country where it's monetized. So I just want you to know I did it out of love for you. So I will count down the 30 days and show you my memories. You know what I mean? The next question is, I just spoke to my son in America and he was asking me, the baby, I spent 17 hours in school, just to get all these degrees. I have a degree in pharmacy journalism and public relations management, the one that David Honey said I didn't graduate, and he pretty much said I didn't have any degrees, but forget all those kind of people. But my son asked me a question that many of you are going to ask. He said, Mom, are you going to PR now? Are you going to be doing PR and all that? No, I'm not. Not in Africa, never. Not in Europe, not in anywhere. Not even in America, I don't know. Unless President Trump tells me to come and work as a PR person in the White House, then you'll see me doing PR. Or maybe go do PR for the embassy somewhere, one of the embassies. But at the end of the day, people, I'm going to rest. I'm going to rest. And my son said, what are you going to do on social media? So I'll probably post me fishing or me buying stuff at the market. A market in Africa, market in America, market in Europe. I'm going to enjoy myself and the world. That's what's going to happen. So I want to thank everybody. April 30th is the last day I'm going to post a health video. So most of April I'll post health videos for you. After that, pages are down. I got to rest, guys. Thank you so much, Dr. Kemi.